Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us this week after Christmas for Delaware's response to COVID-19, our weekly press conference where we bring you up to date on the situation on the ground here in Delaware, COVID-19, the spread of the virus across our state, our latest testing information about the new vaccines that arrived in our state. Very pleased with that development and with the vaccines that have already been administered to our healthcare professionals in the first priority category. I'm joined once again by A.J. Schall, as the director of the Delaware Emergency Management Agency, and Dr. Karyl Rattay, the director of the Division of Public Health. Their teams continue to work extremely hard responding to COVID-19 and testing and contact tracing and administering the vaccination program in our state. Already close to 8,500 Delawareans have been vaccinated among hospital workers and within the nursing home worker population, and we'll be moving to our senior citizens and others. Dr. Rattay will talk a little bit more about that. We're in this period in time where we'll see that the numbers that will be presented today, where our new positive cases are flattening out a little bit from a high of over 800 just a couple weeks ago. As a result, we think of social activity over the Thanksgiving holidays, where families were getting together and lots of parties and get-togethers. It was in response to that we put in place mitigation efforts, an advisory, stay-at-home advisory, recommending that people avoid events with folks outside their household. We'll see how we all did over the Christmas holiday. I know for the first time ever, I didn't spend Christmas Day with my 89-year-old mother. She did have a dinner with one of my brothers, and I know was happy to. I delivered her Christmas Eve dinner at her door, and she was pleased to get a really good dinner. And I know as I talk to friends and other folks that I know that many families celebrated the holidays being safe, being separate from maybe the big gatherings that they've had in the past, to really protect, in particular, our senior citizens like my mother, those that are in nursing homes, those with pre-existing health conditions. Well, we'll see how we did. Right now we're, as I said, and you'll see the numbers in a minute, having fewer cases. Our hospitalizations is staying at a pretty high level. We'll talk about that. That being one of the major reasons that we have the mitigation efforts in place at the moment to give those hospitals the room that they need to treat anybody that presents with COVID-19 symptoms. They obviously have lots of other folks that need hospitalization that have to be accommodated as well. We're seeing in other states across the country a significant problem in the hospitals not being able to tend to those who present with COVID-19. We're not at that place yet. The hospitals are doing a good job in managing their census, the number of people that are in the hospital on a day-to-day basis. AJ will have some more information to show you how that is occurring. So let's go to the data. Overall, now we're up to 5,600 total positive cases since our first positive case arrived in Delaware back March the 11th. Sadly, 898 total lives lost, continuing to track in the wrong direction. The one that we look at very carefully and is very concerning is hospitalizations now at 427. It did dip down to just over 400 just a couple days ago, probably a result of folks wanting to stay out of the hospital over the Christmas holiday. 60 of those who are hospitalized are critical. That's obviously a moving number. People move in and out each day. We've been working with the hospitals to help them manage that population by enabling and other facilities outside the hospital to accept patients that don't need hospital care in skilled nursing facilities and other facilities. And I know that they are managing their population by reducing voluntary surgeries, non-critical surgeries, and managing that population. So in Newcastle County, We're up to almost 3,300 positive cases. Kent County, almost 9,000, 8939. And in Sussex County, 14,600. We'll see in these latest data, really a higher number of cases in Kent County, lower Newcastle County, below the canal, and in Middletown, Townsend, and northern Kent County and Smyrna area. We're seeing a surge in cases, and particularly in Kent County, not seeing outside the city of Dover, not seeing the level of testing that we'd like to see with that surge in positive cases. So those of you who live in Kent County, please make sure you get tested at one of our testing sites, and AJ will talk about that. So if you look, I mentioned a minute ago, the percentage of those tests that are positive now down to 8.5%, 7-day moving average. That was up last week over 9%. So this is starting to flatten out, we hope. And we hope that the mitigation efforts underway over the Christmas holiday will bear fruit and not push that number up and keep that new cases per day, which is now over 650. Just 2 weeks ago, a little short of 2 weeks ago, was up over 800 at 822 with a 7-day moving average. Hopefully we can start moving that down, but we'll see. We'll see what happened. We'll see how closely people followed the guidance, mask wearing, social distancing, avoiding social gatherings where masks weren't being utilized. If you look at our total testing, we're almost at the million test mark. AJ, your team has been doing a really outstanding job there, you know, up and down our state in neighborhoods that were hard to reach at the beginning back in April now get tested regularly. All our population's getting high rates of testing. Total persons that are tested, non-duplicative over 500,000. And so still really big numbers there. And I know you continue through the month of December. I think you've reached over 100,000 tests already with a week to go. Here's the rate of positive cases by demographic group. Again, that young adult population, 18 to 34 and 34 to 35 to 49, having the highest rates there and continue to rise, although you can see them flattening out a little bit. So let's go to the data dashboard and look at hospitalizations. First, you can see the current hospitalization bar on the top far left is fairly flat. It's starting out in mid-December to today. On the far right at over 400. We did reach a couple days ago about 400. Now we're up to over 420, and we'd like to see that flatten out. Again, time will tell how vigilant people were over the Christmas holiday. New hospital admissions are lower each day over that 14-day trend. New positive cases, as you can see, are trending down as well, down to 653 from a peak of over 800 just a week or two ago. And then again, on the percent positives, the bottom row far left is the percent of persons tested positive, so non-duplicative people that are tested, over 500 and close to 1 million total tests in the middle bar at the bottom, and there in the 7-day moving average, just over 8.5%. If you go all the way back with all the data that we have available, starting back in end of March, April, and you can see the top row is the hospitalizations. You can see that peak back in late April with what looked like the good old days now through the summer, where hospitalizations went down as low as in the 30s total, and now back up this surge that we've seen since Thanksgiving and earlier in November, maybe even Halloween and Thanksgiving, where we've have a peak now of got close to 450 last week, now 423, I think it was. And so we need to flatten that out and hopefully trend downward in the days ahead. Again, a lot will depend on how people followed the guidance over the Christmas holidays. There on the top far right, you can see new positive cases. Obviously, we weren't doing nearly the amount of testing that we're doing today, and so likely there was more community spread than this graph shows, but you can see of the new positive cases there peaking at the 7-day moving average over 800, now trending down a little bit, and hopefully that trend will continue. Again, depending on how we did over Christmas. The bottom far left and the middle on the bottom are the percentage of persons tested positive on the left and the percentage of tests that are positive. And you can see we're just doing that peak on the far right. The middle graph isn't quite as high just because the denominator is so high with the number of tests that AJ and his team are doing, just incredibly keeping that below 10%. We want to be below 5% on that, so we still have some work to do there. On the data dashboard for personal protective equipment, you can see that we have a good store of this personal protective equipment. This was a big problem back in the spring. Hasn't been an issue other than on the gloves, I think at one point. We had we were backed up without some gloves, but other than that, good. I mentioned hospitalizations. That's our next graph. You can see the peak back there at the end of April in the spring, and then the improving conditions the end of May into early June and July, and getting as low as below 40 people hospitalized with COVID-19 in the middle of the summer. We started trending up in early October and then again accelerating after Halloween, and then particularly after Thanksgiving now to the run up that we have at 427 on the 28th, which was yesterday. And so you can see on November the 2nd, we were at 107. By December, just a month later, by December the 4th, we were up to 306. And then from December the 4th until yesterday, we went from 306 and added another almost 120 there to 427. We really need to make sure that we flatten that thing out, top out the peak there as we move into the end of this week and into January. And again, the mitigation efforts that were in place over the holiday will determine how effective we are in creating a peak there. So those who are celebrating Kwanzaa, do so safely. Make sure that you're wearing face coverings. We do have a universal indoor mask mandate, which is in effect requiring Delawareans to wear a cloth covering anytime they're indoors with anyone outside of your immediate household. When I have people over to my house that come in and out from time to time, I always put the mask on, really to protect them as much as the other way around, and certainly wearing masks. And I do see very strong compliance when I'm out and about here in the city of Wilmington, northern Newcastle County. Folks understand that that's the most important thing that they can do to keep their neighbors safe and to prevent the spread of COVID-19. We do have, as I said, a stay-at-home advisory in effect. We strongly advise folks to avoid gatherings indoors with anyone outside of your household. So if you have folks that are even family members that don't live in the household where you are, make sure that you're avoiding those, getting folks tested before they come into your household, as we recommended last week with folks traveling in and out of our state. And obviously, a lot of folks have followed that guidance since we've had over 100,000 people get tested over the last several weeks in December. So some good news, some encouraging news as things seem to be flattening out. But again, time will tell as we move out of this Christmas week into the new year and the celebrations. We would just recommend to everybody to be careful. This New Year's, we have vaccines are being distributed across our state. Delawareans are getting vaccinated, close to 8,500, I think, to date. And we have thousands more coming And so better days are ahead if we can just follow the guidance that we know is important every day. So with that, why don't we move to Dr. Rattay, the Director of the Division of Public Health.
Great, thank you so much, Governor. And as always, let me start briefly on areas of concern. And what I have been saying for weeks now, we really do have significant spread across the state. So there is no area of Delaware that is untouched. That being said, we have our highest case rates right now, slightly above and below the canal. So between Delaware City and Odessa and Townsend and Smyrna, we have our highest case rates in the state. And also I want to mention Kent County, which as a county has the highest case rates, the highest percent positivity, the highest hospitalization rates, and still the lowest testing. So again, we want to continue to encourage folks in Kent County to take advantage of the testing options that are available to you to check and see if you are COVID positive, especially if you have been exposed to other individuals. So let's shift now and talk about vaccine. I'm happy to provide a vaccine update. At this point, we know of almost 8,500 vaccines that have been administered. Now, it's important to mention that typically we have about a 48-hour delay in reporting. So we'll see those numbers go up. We also have several EMS events going on this week and next. So we do expect to help protect a number of our ALS and BLS providers, and we'll see those numbers go up soon. This week for our allotment, we're getting almost 6,000 doses of the Pfizer vaccine, which will go directly to the federal pharmacy program for those who are either working or are residents in long-term care facilities. We're also getting 8,775 doses for the healthcare systems, which is the follow-up. So it will be the second dose for those vaccines that arrived over 2 weeks ago. So that's the Pfizer vaccine. And for this week, we have Moderna vaccine, 5,800 doses of Moderna vaccine, which is going to a variety of enrolled healthcare providers, which includes federally qualified health centers, outpatient healthcare providers, which is good. We're happy to now get some vaccine to independent healthcare providers, as well as Delaware Psychiatric Center and Department of Corrections for healthcare providers. So we're starting to get it into new and different places, which we are excited about. And again, we're getting EMS folks, ALS and BLS, vaccinated at this point, as well as the long-term care program is underway. So I want to talk about now some discussions and decisions that have been made about phase 1B vaccine allocation. So we talked a little bit last week about 1B and 1C and the CDC's ACIP, the Advisory Council on Immunization Practices, came up with some updated recommendations. Our ethics committee met last week, our ethics advisory group, and they came together with a consensus around the phase 1B decisions as far as who should be in phase 1B. I think it's important to mention phase 1B, we don't expect to start until towards the mid or end of January. Nonetheless, it's important that people know now what to expect so we can get plans in place. So in phase 1B includes frontline essential workers, which I will get to soon. Now the ACIP recommended vaccinating individuals 75 years and older in phase 1B, and our ethics group agreed to that. They had discussions about going younger. We took a good look at our data, and we made the decision to vaccinate individuals 65 and older as part of 1B. As we know, and as the governor talked about, saving lives, decreasing hospitalizations are a highest priority for us right now. Additionally, we looked at our data and recognized that if we went with 75, we would have a real equity issue. When we looked at our own death data from COVID, the average age for white individuals was 83, but for Black Delawareans, it was 74, and for Hispanic Delawareans, it was 66. And so we were very concerned that we would miss getting to protect some of our most vulnerable populations. So again, in Delaware, we will be vaccinating individuals aged 65 and older in phase B, 1B. So let's talk a little bit about who are the frontline essential workers. So for frontline essential workers, we're essentially looking at those who interact with the public, those who are close to the public, who are most exposed, or those who have a difficult time social distancing, or both. So of course, other first responders like firefighters and police have close contact with members of the public. We know teachers and support staff in schools, as well as childcare, also have close contact with the public. Food and agriculture as well, manufacturing, correctional workers, U.S. Postal Service workers, public transit workers, and grocery store workers all do fit in this category of 1B. That being said, it is important to recognize that in 1B, not every person who works in these categories will be getting vaccinated. So there is more risk involved. I use the example of agriculture, where we have poultry plant workers who are at higher risk because they have close contact. It's harder to social distance, but private farmers are less likely to have the same problems with social distancing. So we're right now really emphasizing to those in these fields to go to our website and fill out the survey, start thinking about your plan for vaccinating the members of your team who are at the highest risk. Let's go to the next slide, where I really want to focus again on the time frame. And you will notice that this is a little bit of a shift, but we have learned that we are receiving a little bit less vaccine from the federal government than we had thought. And so we are, of course, in the midst of phase 1A right now. We are eager to get to phase 1B, which, as I just mentioned, is individuals 65 years of age and older and frontline essential workers. But we do not expect to get to that phase until mid to end of January. So again, please be patient with us. There's just not enough vaccine for everyone right now. But again, it's time for people to, especially employers, to start getting your plans together. For a question we get a lot is for those who are older, where will they get vaccine? And there will be a variety of different places where individuals will be able to get vaccinated going forward. And we will be providing a lot more detail as all of this becomes more clear. So on the next slide, I really just want to remind everyone, whether you're an employer, whether you're a healthcare provider, or a member of the public, that our websites and our vaccine call center and our vaccine email address are all places where you can reach out to us with questions. Our website has a lot of information, but if you have questions, you can go to vaccine. You can send an email to vaccine@delaware.gov, or you can call our call center, the number up here, to ask your questions and talk to somebody. So please utilize these outlets for questions or to develop your plans further. Let me shift gears a little bit and talk about the holidays. Governor Carney talked a bit about the Christmas holidays and the past couple of weeks. We are very concerned that we may see a surge upon a surge from holiday gatherings that have happened so far. We know that many people have made significant sacrifices and not spending time with family members, but certainly, like we saw on Thanksgiving, we're concerned that people did spend time together. We're especially concerned about New Year's. New Year's Eve tends to be a time where people get together. New Year's Day, lots of people come together and watch football. And we just really want to emphasize that this is a terrible year to have in-person parties with people outside of your household. On top of that, consumption of alcohol tends to make people less likely to follow social distancing rules. So as we have seen from our own data, house parties easily leads to super spreader events. So we're strongly urging people, please don't have in-person celebrations at this point. If you have come together with individuals, please make sure that you quarantine afterwards and get tested around 5 to 7 days after being exposed to anyone else. But on the next slide, let me just give a couple examples of things you can do instead of coming together for a New Year's Eve party. Like, something we've been doing a lot of is ordering special dinners from our your favorite local restaurants to celebrate with your immediate family. Holding Zoom parties to try to guess each other's New Year's resolutions, or having video chats to watch the ball drop together. Lots of creative things that we can do together, even though it's different. Just remember, next year, New Year's Eve is going to be better. That light is at the end of the tunnel, as the governor likes to say. Finally, I want to close with just talking about some exciting news for us in public health. This last week, we received our satellite laboratory. Public Health Lab has essentially become a commercial lab over the past 6 months and has had a high workflow and pretty crowded conditions for our laboratory staff. So we're really excited to have this extra space for additional staff and processes, so that we can even process more labs and do it in a safer approach. So on the next slide, there's some pictures. We're pretty excited about our lab. It's pretty high tech. It can hold 4 staff under negative pressure ventilation, and again, provides expansion for us to be able to do more COVID specimen processing. And in the future, it will help us to be able to process highly infectious agents, to continue to expand our current capabilities, streamline workflows, and protect staff and lab properties. And with that, I'm going to hand it back to the governor.
Thank you very much, Dr. Rattay, for that information. A couple of things that really stood out to me is prepare and plan for a safe New Year celebration. In particular, you could kill 2 birds with 1 stone by ordering a wonderful dinner out from your favorite restaurant, where we've all been trying to support our restaurants and our hospitality businesses in our state during this very difficult time. They've been hurt the most. We've made significant CARES Act funding available to them, but they need your help as well. So go to your favorite restaurant, pick up a nice dinner, as I did on Christmas Eve from my mother. She really enjoyed it. Restaurant just across the street from where she lives, and this will give you an opportunity to stay safe with your family and help your favorite restaurant. So stay safe on New Year's Eve and New Year's Day. Watch football all day by yourself and enjoy the new year. AJ, tell us a little bit about testing and where we are, and I think you have some really important news to demonstrate graphically how hospitals are managing their census, and we're answering the question about when we reach capacity there.
No, so thank you, Governor, and absolutely. I'm going to start off at the hospital slide at first. So Really since April, we've been working with the hospital partners across the state, as well as a team of research specialists from University of Delaware that have been nothing but a great asset to us. And well, the slide we're looking at now is, could it help us? Because I know we get the question almost weekly, when are we full? When do the hospitals have no more room for patients? So the graph that you're looking at right now is from November 1st through yesterday, and it's broken out from the top, from the bottom going up. So the blue bar is COVID patients. The little orangish yellow line there is those patients that are under investigation. So suspected potential COVID patients, but they're waiting for the results of the test. And then the gray area is the rest of the patients for a number of reasons that are in the hospital system. And so this is the hospital system across the state. And as you see, our high water mark was in early December after kind of that Thanksgiving surge that we've talked about. We saw a decrease in the hospital capacity around Christmas time, which is anecdotal that, hey, people aren't going to have elective surgeries around that time. And then second of all, with 20 plus years in the, public safety community, I'm well aware and know how people over weekends and holidays will put off their own self-care. They will not dial 911 until the last possible moment if it's around a weekend. And it's you hear people say it time after time on the ambulance when that happens. So, we expect there to be an increase post-Christmas, naturally, both COVID, non-COVID type related calls. But this right here shows you that, hey, it's a balancing act. The hospitals watch this closely. The partnerships we have between the governor having leadership calls once a week with the hospital executives. But we have coordination calls 2 other times a week with the hospitals to talk about capacity, really look at stuff about 10 to 14 days out. We can't really look farther out than that, but what do we need to do in the next 14 days looking at the trends? Because you just can't look at 1 day or 2 days at a time. So again, this is just a tool we use to make sure we keep our fingers on the pulse. I know people are looking for a number, but we look at the health of the overall health system across the state. So we'll keep reporting out on this. Hopefully it helps people understand, what's going on behind the scenes a little bit more. So now moving over to testing, again, a busy week this week with events. We have 13 in Newcastle County, 4 in Kent and Sussex as well this week. This is just the community testing site. So this does not include the Walgreens. And if you remembered, about 2 weeks ago, we added 6 additional Walgreens across the state that are participating in the state testing program now. This does not involve the service centers or the clinics that are open Monday through Friday, with the exception of the holiday hours. So this is, the high throughput events that we're still seeing, thousands of people a day. Yesterday, between the events in Newcastle and Kent and Sussex County, we did 11,000 individuals. So we expected to see a rush after Christmas, and we expect to have that tempo to stay with us through, the first few weeks of January. Next slide, please. So the other exciting thing, and a shout out to the Government Information Center, a team that really has worked tirelessly since beginning of March to help us get as much information out there about COVID. And I know we have thrown a lot of information out there, people. I know it's been, information overload, drinking from a fire hose is what some people say, but we worked on kind of simplifying the new testing, a new testing calendar. This went live last week. Again, same functionality. You put in your location, you could put in, if you want a reservation, if you're not, to identify where those sites are. This is where people go. We will get those PDFs out, over the weekend, each week for the next week. But just today we had to delay it down at one of our sites in Sussex County that wasn't expected. We were able to go to this site and modify the hours. So this is kind of home base for going to find out where can you get the information. So it should have a little bit easier look and feel now. We have a lot of options. So outside of the 20 plus sites that we'll do through our community testing event, we have the other static sites that are 30 almost a week now if you look at them for each day. And there are a lot of private partnerships on here as well, whether it's a clinic, different doctor offices, different labs. So testing is not the issue it was a few months ago. It's just finding out what works for you and is convenient to your location. So you could check that out at de.gov/get tested. Also, the other thing they did when they updated the website is put some additional resources in there. So this will have information on school testing. The home test link is still on there, which is a great option for individuals that don't that have time to plan. We explained what type of tests are there. So it's either the shallow nasal test that is the as Dr. Pescatore says so eloquently, is almost like picking your nose. The deep nasal test, which people did not, there's a lot of people that were uncomfortable with that to begin with, and then we have a lot of saliva based now. So there's definite options out there for people. And again, the whole website was redesigned and has a lot of information, still links to My Healthy Community and the other resources that needed. Getting into the numbers for testing the last week. So we were at 45,000 last week, which yes, everybody's gonna say we dropped 15, 16,000 from the week before, but we also had several sites closed on both Christmas Eve and Christmas Day. So if you would have, pulled out the averages per day, we've been right back at that 60,000 number. This week we have, the only day we have testing suspended is on New Year's Day, so on Friday. So I expect us to be up in the high 50s again for next week. And, if you look at that, we'll be up in the, 200,000 range almost probably for the next few months as we go through. So definitely kudos to, the staff of public health here, our partners, Newcastle County, National Guard that's helped us, the partnership with Walgreens and all these other private practices that are making sure they have the interest of the public, front and center. So that is it, sir. I'm going to turn it back over to you.
So thanks very much, AJ. Tremendous work there. Well over 100,000 tests already in December, breaking the November record. People obviously were following the advice of getting tested leading into the holiday. As people came back and traveled in and out of our state, we recommended folks kind of stay at home and avoid mixing households. But an alternative to that was obviously to get tested, know your status, protect one another when you're mixing households. So we still have lots of opportunities for folks to get tested. We need those of you who live in Kent County in particular, where we're seeing a surge outside of the Dover area, mostly in western Kent County and northern Kent County and southern Newcastle County. Southern Newcastle County for the longest time, for months, had the highest, among the highest testing rates, and still very high up there. But had very low positive cases. Now that's flipped a little bit the other way. So we need to push that down with mitigation efforts. The most important mitigation now looking ahead is for New Year's Eve and New Year's Day, is just to avoid that unsafe social activity. It's a lot of fun, but this year it's very dangerous for individuals, for families, and for our broader community. Think about businesses that we'd like to bring back more fully online. We have limitations, fire code limitations for hospitality and all businesses for that matter, including worship services, a mandatory mask wearing, stay-at-home advisory. All these mitigation efforts are to say, look, let's everybody pitch in so we can flatten that curve. We can push that peak down and get to better days. Better days are on the horizon with the vaccination program underway. Already, we've had almost 8,500 people vaccinated in our state. We need to ramp that up just like we ramped up testing. This has got to be more controlled as we target the priority groups first with our frontline healthcare workers, our first responders in 1A, nursing home workers and nursing home residents, those 65 and older as we move into to 1B and beyond. So just some great work across our state on testing, mitigation efforts. Those of you who are pitching in, we did add millions of dollars more to the support for the hospitality industry and other small businesses, and of course, vaccination delivery across our state. So with that, I know we have media that's joined us on the call, and we would welcome any questions that they have at this point.
All right, first we'll go to Amy Cherry from WDEL.
Hi, my question is likely for Dr. Rattay. I'm wondering about eligibility criteria to receive the vaccine. Say if you work in Delaware but live in a surrounding state, are you still eligible according to your profession to be vaccinated here in Delaware?
Yeah, Amy, that's a really great question. And yes, if you are a worker in our state, either healthcare worker, EMS, long-term care, or as we evolve into phase 1B, if you are working in our state, you would be eligible in our state. And it's the same thing for people who live here but work in Maryland or Pennsylvania or New Jersey. Many will be likely to get the vaccine through their employer first. And so it is thought that it will probably be a relatively even exchange across states where people, if they get vaccinated where they work.
A quick follow-up to that too. I noticed that you said that they would likely be vaccinated through their employer. So are employers tasked with contacting DPH to sort of set up that program, or will there be vaccination periods where someone can show up to, say, CVS and say, I work in this industry and they've been approved to get the vaccine?
Yeah, so there's such a variety of different employer types out there. So there's going to be a variety of different approaches. In some of the manufacturing areas, like the poultry plants, as an example, they often have a healthcare team, and they're able to completely manage the vaccination process themselves. But there's other examples. Childcare is one that I use at times, where often they're small centers, and it won't make sense for them to vaccinate, in each center. So likely they'll be getting a voucher, which will enable them to go to a pharmacy that accepts vouchers to get vaccinated. So there are going to be some different approaches. There will be some events, closed pods, we call them, but closed events where, for example, one type of profession may choose to partner with a vaccinating partner and make times available for their team to get vaccinated. So what we really advocate right now is for employers to spend some time on our website, fill out the survey, get the information to us, so they can start really getting their plans together.
Next, we have Roman Battaglia from Delaware Public Media.
Hi there, Governor. My first question is back to the sort of holiday surges that we've seen. When could we be expecting a surge in cases from events that people attended during Christmas? And there's a lot of talk about these surges upon surges. What would be the breaking point for hospitals? And could this major surge mean sort of, I know a lot of people are talking about the news rationing care in hospitals. Could that be a thing in Delaware if we see a big enough surge?
Well, that's what we're trying to avoid, a rationing of care and the inability of hospitals to have mostly the staff, as they tell us, the capacity to serve patients that present themselves with all the conditions, including COVID-19. And I hope you saw the graph that AJ described earlier. And so it is a question of managing that population. And therefore, it's been really difficult and maybe impossible to put a pin in a specific number. We are incredibly concerned about a surge on top of a surge. We saw the surge coming out of Thanksgiving. It appears to be flattening out at the moment, hopefully heading in the opposite direction. What we can't afford to have now is a surge coming out of Christmas that mirrored what we saw coming out of Thanksgiving. Turn it over to Dr. Rattay, but mostly we talk about 14-day intervals. And of course, people becoming sick enough to need hospitalization may be less than that time or a little bit more than that time. So there is kind of a range as I understand it. The fundamental point, though, the message for Delawareans is we can't afford a surge on top of a surge when we're already starting with a high level of hospitalizations across our state at 427, the highest that we've ever been. We know we're getting close to the top, but we can see with this chart that's up on the screen now that the hospitals are managing that by reducing their census in some other way. They're also doing it by moving COVID-19 patients out treating them effectively, moving them out into other locations that they can be cared for appropriately, which we didn't have that capacity to do that as much in the spring. We will continue to look at alternative settings, although all the feedback that we have, the most effective thing is what hospitals are doing with our support right now, managing their census, moving people along, particularly now since the quarantine time has been reduced to 10 days with a test at 7 days with a test. Dr. Rattay will give you the number, 10 days I think it is, and then 7 days with a test at 5. Dr. Rattay?
Sure. So it's a great question. When would we see the change in the numbers? And typically after people have been exposed, 5 to 7 days after exposure, you'll have a positive test. But you start to see your numbers go up 5 to 7 days after exposure, but then they often continue to go up as it transmits to others beyond. So, I think an uptick right around New Year's Eve, New Year's Day, which, there won't be a lot of testing going on those days, right? But either before or after is when, we would expect our numbers to go up, possibly more. And then, of course, again, a week later from New Year's, I think we're going to be holding our breath until we get probably 3 weeks from now to see what our numbers look like. And then, of course, as always, it's quite predictable. You see increases in cases, and then several weeks later, you see an increase in hospitalizations. As the governor said, the hospitals are doing a lot to manage their patients. There's a lot of different efforts, whether it's vaccination of long-term care residents that's going to be helpful, using monoclonal antibodies for long-term care residents and monoclonal antibodies for others in our state who are eligible. All of those are efforts to decrease hospitalization, but needless to say, we are very concerned about these potential surges ahead of us and the impact that may have.
Yeah. And lastly, could you guys give us an update on the state of COVID-19 outbreaks in long-term care facilities? How are those doing right now? Are the facilities doing enough to prevent those sort of outbreaks? And would the state consider putting tighter restrictions on long-term care facilities?
Yeah, so we are concerned about, it's not surprising that we've seen more cases among staff and residents in long-term care over the past month, given the significant increase in community spread. So that certainly is very concerning. We do have a team, an incident response team that's been working with long-term care facilities on prevention efforts. The testing, certainly is helpful. And in Kent County and in many places across the state, visitation has been significantly decreased or eliminated completely, which is unfortunate. I will say this is a reason why I'm so happy that we are beginning our efforts to vaccinate both staff and residents in long-term care, but certainly we are concerned about the impact of our high levels of community spread on long-term care currently.
All right, next we'll go to Sarah Gamard from the News Journal.
Governor, you have said before that staff is in ways a bigger issue for hospitals right now than capacity as they deal with the wintertime surge. How much are hospitals struggling right now to recruit staff, and has your emergency executive order helped at all to alleviate that?
Yeah, so we'll know better later this week when we have our weekly call with them, but the change in the guidelines from CDC for quarantine for direct contacts has really helped them free up staff sooner. I can't remember exactly the numbers, but it was a significant improvement on the availability of staff. I want to say on the order of 30% or thereabouts. staff coming back sooner, which really helped them. So yeah, so and on the other side, I don't have a good feel, and I don't know whether Dr. Rattay does, about licensure and the ability for them to get additional staffing on board. We can certainly, we'll certainly find that out when we talk to them later this week.
Yeah, I know. We know they were grateful for the order to be able to hire retired and out-of-state staff. But as the governor just said, what we've really heard loudly from them is how helpful these new quarantine guidelines have been for them. And so I think that's probably been much more important than the order, but we're glad that they have both to help them with the staffing capacity issues.
And Governor, we're nearing the end of 2020 with nearly 900 reported COVID-19 related deaths in the state. What do you want to tell all of those people whose loved ones were part of that number?
Well, our heart aches for them, obviously, and I hear stories all the time of parents and grandparents dying alone, and the thought of that, having been through that with my own father a few years ago, is just really devastating. To think that you can't be with your loved one as they pass. There was actually a story that I heard on the radio today, and so our heart aches. I mean, it really just does, and it should be for all of us just extra incentive to do our part individually to protect those vulnerable folks, who many of whom are living out their last days. They want to be with family. They should be with family, and so. But we can all do a little bit by doing our part to prevent the continued spread. We've seen an enormous amount of spread in our state over the last 2 months. Not quite as many fatalities at the rate as we saw it in the spring. And that says a lot for both the hospital's ability to treat the patients, our continued focus on protecting those populations, and the work that nursing home workers and those places do with that population. But, you know, even younger people and those that are healthy are at risk for a serious case with a serious exposure to the virus. And, you know, our heart just goes out to those folks as we end this terrible year.
All right, last we'll go to Tim Mastro and Noah Zucker from Delaware State News. First, we'll go to Tim.
Hi, Governor. How are you?
Good.
So when you announced the stay-at-home advisory, I know you also announced a zero tolerance enforcement policy for businesses. How has that worked so far? Have you found that has successfully deterred businesses from breaking any restrictions? And has there been any cases where you've had to come down with significant enforcement action?
Yeah, I have not had a report yet from our enforcement folks on that question. My guess is, just on anecdotal kind of observations and reports, is that a lot of people were circulating. A lot of people were out doing Christmas and holiday shopping, and hopefully they were limiting their number of trips. At the same time, parking lots at malls weren't as full as they normally would be at some of our retail establishments. I don't have a good feel for the hospitality folks. I know that they've been hit extremely hard and continue to be very concerned about their individual futures. But we'll have that kind of a report from the enforcement side. But in the final analysis, it will be measured by the reduction in positive cases and ultimately the flattening out of the need for COVID-19 hospitalization treatment.
All right, this is the last question. We have Noah Zucker from Delaware State News.
Hi, thanks for having me. I appreciate it. So my first question here is, do you guys know to what degree people cooperated with the state's recommendations during Christmas?
Yeah, it was similar to the last question. I don't think we know yet. I mean, ultimately, the measure is the 7-day moving average on new positive cases, right? Those measures had a purpose, which was to limit the exposure of folks to people that are carrying and shedding the virus. My guess is that it's a little bit mixed without knowing for sure. Obviously, our case count is flattening out a little bit, as you saw today. Hospitalizations, percent positive of tests is going down a little bit, not to the level that we'd prefer. And hospitalization is at a very uncomfortable level as we move into New Year's celebrations and what that might mean for the spread of the virus and the need for hospitalization after that. So ultimately, that's the measure. And we'll see over the next couple of weeks how well folks did.
Got it. And one quick follow-up. Did the state explore any worst case scenarios for the holiday season? And do you have any indication that like how close did you guys get to those worst case scenarios, if you did explore them at all?
Yeah, so we talk about that all the time when we talk about hospital capacity, and hopefully you saw the chart that we had earlier today, which demonstrated that at 4/27, the total hospital census has stayed fairly consistent over the last couple months, which means the hospitals have been managing the uptick in COVID-19 patients that have been admitted to the hospital by reducing others that are in the hospital for elective surgeries and that type of thing. They've also been moving COVID-19 patients out, as they've told us, more quickly than they did back in the spring, better treatments. As Dr. Rattay has said, they've have additional staffing as a result of the change in CDC guidelines for quarantining, so they're able to accommodate more. We're vaccinating now nursing home residents to hopefully avoid the need for hospitalizations for those, the most vulnerable populations. Each of the hospitals are using monoclonal antibodies as treatment, again, in part to prevent need for a longer stay or stay at all in the hospital. And so all these mechanisms have been employed to reduce that worst case scenario, which would be hospitals without staff probably to serve and provide treatment for COVID-19 patients that present.
That was it. There's no more questions.
All right. Seeing that there's no more questions, I want to thank again Dr. Rattay and her team at Public Health for all their good work, AJ Schall, and our testing team, which has just done an incredible job blowing past the 80,000 tests, which was our goal several months back, now well into the 100,000 plus tests per month as we move through the holiday season. I thank everybody for their vigilance here, for being safe, for wearing a mask, for keeping appropriate social distance, for avoiding gatherings, particularly indoors with folks outside of your individual household, for being safe over the Christmas holidays now as we move into New Year's Eve and New Year's Day. But just be careful. It kind of goes back to the question of a minute ago. What do you say to those family members who've lost a loved one over the last 10 months? And, you know, our heart bleeds for all of those, and we can each do our part by preventing the continued spread of COVID-19 now as we enter 2021. We have vaccines coming. almost over 8,400 Delawareans have already received the vaccine and thousands more to come. And we look forward to ramping up that effort. So enjoy your New Year's celebration quietly and at home and safely. And God bless you in the new year.